Welcome, everyone. Thank you so much for joining us today. My name is Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General Hospital. Today's program is a special collaboration between the Blum Center and Mass Eye and Ear. Before we get started, I just want to go over a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, you may visit the Blum Center website at massgeneral.org/Blum-Center. Please note that you are in listen-only mode. Everyone has been muted so they can hear a guest speaker today. If you have any questions for our guest speaker, you may use the chat feature, which is located at the bottom of your screen. We'll have time from the end. Only Blum Center staff and our guest speaker will see your questions. Please do not share any personal medical information or questions in the chat box. If you have a personal medical question, please ask your doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which we would like to ask you to take. Your feedback is important to us as we plan future programs. So next, I would like to introduce you all to our guest speaker. Joining us today, we have Dr. Silas Wang. Dr. Wang is a board-certified comprehensive ophthalmologist at Mass Eye and Ear, an instructor in ophthalmology at Harvard Medical School. He specializes in cataract surgery and also provides treatment for a variety of ophthalmic conditions. He has a special interest in medical student and resident education. In recognition of Cataract Awareness Month, he joins us today to give a talk on cataracts and eye health. So please join me in welcoming Dr. Wang.
Thank you very much. Thank you for being here. Thank you for the opportunity to share with you a little bit about cataracts and some tips for eye health. I'm Silas Wang. I'm a comprehensive ophthalmologist at Mass Eye and Ear, where I do cataract surgery. I'm also in the Department of Ophthalmology at Mass General and an instructor at Harvard Medical School. So let me just, here we go. I'm going to spend most of the time today talking about cataracts, which is a topic of interest for a lot of people, of course. And then also have some time to talk about tips and strategies for maintaining eye health. And then we should have time to open this up to questions as well. So as you just heard, June is Cataract Awareness Month, so it's a timely topic. And cataracts are the leading cause of vision loss that cannot be corrected with glasses. And so it is a major problem that affects a lot of people. So before we talk about cataracts in particular, let's just take a quick look at the structure of the eye so we know exactly what we're talking about. So we can think of the eye as working kind of like a camera. And so the light comes in through the front part of the eye. The clear outer covering is the cornea, and passes through the pupil, which is a small opening in the iris, which is the colored part of the eye. And then right behind the iris, we can see that there is a lens. So this is the natural lens inside the eye. And then the image gets focused onto the back part of the eye, which is the retina. And that is the sensor of the eye, and it senses the image and then sends the information to the brain. So that is like the sensor in your digital camera or the film in a non-digital camera. So what is a cataract exactly? So cataract is cloudiness of that natural lens inside the eye. And here I have some examples where these are somewhat more advanced cataracts, so it's more visible on the slides. But the cataracts do come in a variety of different degrees of severity, and sometimes they can be much more subtle than this. But in these images, we've also dilated the eyes so that it's easier to see the cataract. And this is what we do when we see you in the office, dilate the eyes so we can see the cataract better, as well as seeing things in the back part of the eye better as well, the retina, for example. So what's important to know is that the cataract is not some kind of a film that grows over the eye or over the lens. It is the lens itself that becomes cloudy. And so what are some of the symptoms that cataracts can cause? As you may imagine, that if your lenses are cloudy, it's kind of like having cloudy or dirty glasses. So a lot of people will describe blurry or cloudy vision. Some people would describe it as being foggy or hazy. Oftentimes this means that you need more light to read, that the contrast is not as good, and low contrast things that you're looking at in particular are difficult to distinguish. Because the cloudiness catches the light and spreads it, it can also cause glare and halos and starbursts, especially at night. And especially one thing that affects a lot of people is the glare coming from oncoming headlights from cars when driving at night. You can also have various kinds of optical distortions, such as ghost images or double vision. And there's a simulation here on the slide showing a simulated image of what vision with cataracts can look like in comparison to someone with normal vision. Because the cataract is your lens, as the cataract progresses, it can change how the lens focuses, and it can cause frequent changes in the prescription of the glasses as well. So sometimes that is an indication as well that the cataracts are progressing. It's also important to think about what kinds of symptoms are not caused by cataracts, because that means that there's maybe some other condition that needs to be investigated, either instead of or in addition to the cataracts. So things like sudden loss or change in vision would not be expected to be caused by cataracts. They generally progress very slowly, with some rare exceptions. So any sudden changes would be unusual for a cataract. Also, because the cataract itself does not, the lens itself and therefore the cataract do not have any nerves, things that you feel, such as pain, itching, and things that cause tearing, usually would not be caused by the cataract either. Because the cataract does not come and go, because it progresses gradually over time, intermittent changes in the vision, especially things that you can kind of blink or rub away, changes that come and go are also not caused by cataracts. And blind spots within the vision where you can, there's a part that there's no vision, but then you can see around it, generally are not caused by cataracts either. So if you have these other kinds of symptoms, it's important to have that checked out, because there's something other than cataracts or in addition to cataracts that may be affecting the vision that needs to be looked at. So let's talk about what causes cataracts. The most important cause of cataracts, unfortunately, is age. And unfortunately, all of us get older and don't get any younger. So cataracts, everyone develops cataracts eventually. It is inevitable, although everyone's cataract grows at a different rate. There's some other major factors that accelerate the growth of cataracts. Smoking is an important risk factor. So it's important to avoid smoking. UV exposure as well, meaning sunlight. So it's important to protect your eyes from the sun. And major injury, such as being hit in the eye by being punched, or being hit with the ball, or being hit with a tool at work or something like that. That kind of injury can also accelerate the growth of a cataract. So it is important to protect the eyes from injury as well, of course. And there are certain medical conditions that can accelerate the growth of cataracts as well. Diabetes is one of the most common medical conditions that can cause cataracts to grow faster. It is important to keep your blood sugar under control as much as possible. Steroid medications, especially used around the eye or taken systemically, meaning throughout the body, can be a risk factor for cataracts as well. A condition called uveitis, which means internal eye inflammation, can accelerate cataracts. And prior eye surgery, especially surgery for the retina, can accelerate cataract surgery. Radiation as well, for example, radiation therapy for cancer, as well as various other kinds of assorted genetic, metabolic, and congenital conditions can cause cataracts as well. So let's talk about cataract surgery, which is the main part of my talk today. So how are cataracts treated? And the treatment for cataract is surgery, which is really a lens replacement surgery. So we remove the cloudy natural lens from the eye, and we put in an artificial lens implant, which remains permanently in the eye to replace the natural lens. So here's an image of the procedure where the natural lens is being removed, and then once it's been removed, an artificial lens is implanted in. Unfortunately, it is not possible to treat cataracts with eye drops or other medications. At this point, Really, the only thing that is effective for cataracts is to remove it with surgery. But the good news is that cataracts do not grow back after surgery. So once you have cataract surgery done, the cataract itself will not come back. So then the question is, when should cataracts be treated? And not every cataract necessarily needs treatment. So this is something that you determine along with your ophthalmologist to determine when is the right time for cataract surgery. But if your vision loss from the cataract is preventing you from doing your daily activities, then cataract surgery could be of benefit to you. So thinking about things such as reading, driving, using the computer, working, watching TV, playing sports, those are the kinds of things that we rely on our vision for. And if we're having difficulty doing these things because of the vision and it's because of the cataract, then it makes sense to do cataract surgery. So importantly, it's not the exact number or measurement or appearance of the cataract that is the most important factor. So a lot of people ask, what is the cutoff or threshold for cataract surgery? And the fact is, it's a little different for every person, depending on how much the vision change is affecting you. And so for most people, as a sort of guideline, the level of vision where it starts to affect daily activities is about 20/40 or so. That is the cutoff for renewing your license, your driver's license. And so that makes sense that that's when most people will be affected enough that it makes sense to do cataract surgery. But it is different for different people. So some people may do well with the vision, even though at a lower level, and don't have problems. And some people have trouble with their daily activities, even though the vision has not gotten that bad. So it is a measure of function that we have to look at. There's also kind of an old term that a lot of people may remember, which is the ripeness, quote unquote, of the cataract. It used to be that you had to wait until the cataract really became advanced or ripe, so-called, in order to do cataract surgery, because the technology and the techniques were not as good, and cataract surgery was much more risky, and the recovery time was much longer. So you really wanted to wait until the cataracts were really bad before doing the surgery. But that's something that isn't the case anymore. And so there isn't, we don't think about ripeness anymore. That's something that was in the past. So age is also not a major factor. It is a factor, but some people do need surgery at a younger age. Some people do develop more problems with their vision at a younger age, and some people maintain good vision for a long time. And it is possible that some people in their 90s need cataract surgery, and we do sometimes do cataract surgery in that age group. So it's not the primary factor that some people are worried about being too young or too old for cataract surgery. And that's really not the primary factor. So on the other hand, if the cataracts are not causing problems with your vision and your daily activities, then you may not need cataract surgery. Just because it's there doesn't mean that it necessarily has to be removed. So not all cataracts have to be treated, but they should be monitored, and sort of the evaluation of the cataract and your vision is combined with the evaluation of your functional activities and the impact that the cataracts are having on the functional activities. And so that's done in a conversation with your ophthalmologist, that is your cataract surgeon, and the ophthalmologist will help guide your decision on when to have cataract surgery. And that's based on the balance of risks and benefits to you in your individual situation. So it is an individualized decision. So moving from when to why should you have cataract surgery, of course, we hope to improve your vision, but because cataract surgery nowadays is very safe and effective with over 95% success rate, it's something that most people who have visually significant cataracts can benefit from. It basically, the main reason is to help you do your daily activities better, because seeing better helps you read or drive or use a computer or work better, or do your hobbies, watch TV. So the primary reason to do cataract surgery is to help you live better. And there's also studies that have looked at additional benefits beyond just the vision. So these benefits extend to other parts of our lives, overall quality of life, a reduced risk of falling and having fractures, is a proven benefit of cataract surgery, and as well as fewer motor vehicle accidents. So there's additional benefits extending beyond just the fact that you can see better and see more comfortably. So because cataract surgery is overall very safe and effective, and because it is something that affects so many people in the age group today, more cataract surgeries are now done in the US every year than any other kind of incisional surgery. So let's talk a little bit about the process of cataract surgery. It's not just the surgery, but there's planning and there's aftercare, which are both important for overall success. So just to go over the steps, and I do go over this in a little bit more detail on the subsequent slides. First is a consultation with the eye surgeon, your ophthalmologist, including a complete eye exam, see how the cataract is affecting you in your daily life, talk about the risks and benefits of the surgery, the limitations and expectations, and discuss various options that may be available in terms of the surgery or the lens implant. And then there is some pre-surgical planning that is necessary, measuring the eye, deciding on these options, and then making sure that your body is optimized for surgery as much as possible. So that meaning that you're as healthy as you can be going into surgery to reduce the stress on your body. Then, of course, the surgery itself, it is day surgery, meaning you go home the same day without staying over in the hospital, and it's done with local anesthesia with sedation. And then the aftercare is important too. The eye needs to heal after surgery, and so there are some precautions that we ask you to take. There are usually eye drops or other medications that you need to take. There are follow-up eye exams to make sure that the healing is progressing the way that we would expect. And then in the end, once everything settles down, as needed, a new eyeglass prescription. So starting with the first step, consulting with your eye surgeon, your ophthalmologist. Again, it's important to have a complete eye exam to see if there are any other conditions that may affect your vision other than or in addition to your cataract. And it's important to know about those because there may be other things that may need treatment, or there may be things that may affect the surgical plan, or may increase the risk of complications, or may affect your vision even after the cataract surgery. So it's important to know those kinds of things before going into the surgery. We want to evaluate how the cataract is affecting your vision. So how advanced does the cataract look? How much cloudiness is there? Does it seem to correlate with the decrease in vision that we're measuring? And how much is the cataract affecting your daily activities? As we talked about before, that is one of the main factors that plays into the decision of whether or when to do cataract surgery. And then we want to go over risks and benefits, even though, as I mentioned, cataract surgery is overall fairly safe and routine. It is still surgery, so there are still some risks that need to be discussed. And we want to make sure that what benefits we can expect outweigh the risks that can be expected. And so we want to make sure that balance of risks versus benefits is favorable for you. We want to consider what are the expectations from the surgery, depending on what else is going on inside the eye and your overall health, and what are the limitations of surgery. Based on our current technology, we can do a lot to restore vision, but unfortunately, there isn't a 100% cure for everything, and we can't return your eye to the condition that it was in when you were 20 years old. even with the most advanced technology. So there are always going to be some limitations as to what modern medicine can do. And then we discuss options. So some of the options that may be available, some of them have to do with anesthesia. Sometimes there's more than one type of local anesthesia that's appropriate. Lighter versions, which we call topical or intracameral, where only the front part of the eye is numbed, versus a more a deeper kind of local anesthesia called an eye block, usually parabulbar or sometimes retrobulbar, which is numbs the eye more thoroughly and is a little more comfortable, but slightly more invasive. We want to consider what the target refraction, meaning how we want the eye to focus after the surgery. So this is an important decision for someone undergoing cataract surgery. Remember that we're replacing the natural lens with an artificial lens. So we choose the power of the lens implant based on how we want the eye to focus, whether we want to focus the eye for distance, which is the most common situation, which does mean that you will need reading glasses or bifocals to see up close. Or some people who are nearsighted and can see up close, are focused up close naturally, may want to keep their ability to focus up close without glasses, but keeping in mind that that means you need distance glasses. Now there is a option called monovision, which is best for people who have it naturally or have tried it with contact lenses before, where one eye is focused for distance and the other eye is focused for close. And that allows each eye to see something, focus on something different, so that it reduces your overall need for glasses, because one eye is seeing distant things and one eye is seeing near things. And then there are options that are called, sometimes called advanced technology lenses or premium lenses. They're called that because they're not covered by insurance and require you to pay extra. But there are lenses that have additional features where the lens implant focuses on both distance and near at the same time. So that's a multifocal lens, or something called extended depth of focus, where instead of just focusing on one point, the depth of focus is extended a little bit so that you have a little bit of a range of focus. And these are options that may not necessarily be available or appropriate for everyone. So this is something that you want to talk about with your surgeon. There are some trade-offs, especially with quality of vision, because you're trying to get more out of the lens. There is a little trade-off in the quality of vision, not being quite as good as the single focus or multifocal lens that only focuses on one distance. There's also a possibility of correcting for astigmatism. Astigmatism is when the surface of the shape of the surface of the eye is not perfectly round. So it's a little steeper in one direction than the other direction, kind of like the shape of an American football as opposed to a soccer ball. And that astigmatism is usually corrected with glasses or contact lenses, but can also be corrected with a special lens implant called a toric lens that has astigmatism correction built into it, or it can be corrected with the procedure that's done at the same time as cataract surgery called limbal relaxing incisions, or arcuate incisions, or astigmatic keratotomy. They're just different names for the same thing, where we can make small incisions in that cornea to change its shape to reduce the amount of astigmatism that is there. These options also do involve extra cost because they're not covered by insurance as well. And then there is something that some of you may have heard about, which is laser-assisted cataract surgery. This is called femtosecond laser assisted cataract surgery, where a laser can be used to do some of the steps of the cataract surgery. You can't do the entire surgery just with the laser, because you still need to remove the pieces of the lens, the natural lens, out of the eye and put in the artificial lens into the eye. But the laser can be used to do some of the steps, make some of the incisions, do some of the breaking up of the cataract, so that we can end up using less ultrasound. And it can help to improve the alignment of the lens, especially if you're having one of these premium lens options, which are more sensitive to the alignment. Overall, for most people, though, the overall outcome is similar. So there are some particular situations where there is an advantage. It is an option that is available in many places. It does cost extra, again, because insurance does not cover the cost of the use of the femtosecond laser. So these are all things that your surgeon may present to you as options that you would have to make decisions on. So in terms of planning for the surgery itself, we need to take measurements of the eye. And this, the more accurate the measurements are, the more accurately we can choose the power of the lens implant to get the result in terms of the focusing result, the refractive result that you're looking for. And sometimes it is necessary to take multiple measurements to get the most accurate numbers possible. And then at some point before the surgery, you do need to decide on these options that I described earlier. Again, not every option is appropriate for everyone. Some will be appropriate in certain situations, and some will not be as appropriate in other situations, depending on the measurements of the eye, what else is going on inside the eye, and what your overall goals of vision are. And every option does have trade-offs. And as I mentioned, some of these options do cost extra. So you have to decide whether it's worth it for you or to pay extra for some of these options or not. So it is very important to make sure that you understand these options, have a chance to discuss these with your surgeon, and are comfortable with the decision going into the surgery. So the other thing before surgery is to make sure that your body is as tuned up for the stress of surgery as possible. Although cataract surgery is not as much of a stress on the body compared to other kinds of surgery, there is always going to be some stress of the sedation and the surgery itself. You want everything to go as smoothly as possible, and that means making sure that whatever medical conditions you have are as stabilized and well controlled as possible, especially things like diabetes and blood pressure, and making sure that the sugar and the blood pressure are as much under control as you can get them. And this minimizes the risks of complications with the anesthesia or to the rest of your body. Make sure that if you're having new symptoms or unstable symptoms, such as chest pain or shortness of breath, make sure those things are checked out ahead of time so that there isn't something else actively going on in your body while you're having surgery. Then on the day of the surgery, the surgery is done with conscious sedation. As I mentioned, it's done with local anesthesia, so it's not necessary to be completely asleep for the surgery. So general anesthesia is not necessary except under very specialized circumstances. Because you're getting sedation, it usually means that you shouldn't have anything to eat or drink after midnight the night before, just like with most other procedures. And either your primary care doctor or your surgeon will advise you on whether to take your usual medications the day of the surgery. Again, you don't have to stay overnight, but you do need to have a responsible adult take you home because of this sedation. And talking a little bit about the surgery itself, this is the modern cataract surgery as it's done here in this country today. We use ultrasound to break up the cataract into small pieces so that we can remove the small pieces out through a small incision instead of having to cut open the eye and remove the cataract in one piece like we used to have to do years ago. As I mentioned, the femtosecond laser can be used to do some of the steps, but we still need to go into the eye, remove the pieces of the lens, and put in the artificial lens implant. And as I mentioned, we can go through very small incisions, and they're so small that they often don't need to be sutured. So most of the time, this is going to be sutureless surgery. And there is usually takes half an hour or less, depending on exactly what needs to be done. The risk of bleeding is minimal. There usually is no noticeable bleeding, but sometimes there's bruising either on the white part of the eye or on the eyelid, that can be very common. Usually you will go home with either a patch or a clear plastic shield to protect the eye on your way home. So the aftercare, as I mentioned, is also an important part of the entire cataract surgery process. So there are certain precautions that we ask you to take. The details are dependent on your individual situation, the type of surgery that you had, and what your surgeon thinks are important. But in general, we ask you to avoid strenuous activities and things that increase the pressure in your head, such as lifting heavy objects or bending over. We do want to protect the eyes when you're outdoors to prevent things from flying into the eye, and while sleeping so that you don't accidentally rub or put pressure on the eye while you're asleep. Avoid getting water or anything else in the eye while it's healing to avoid infection. But it is fine to use the eye even immediately after the surgery. Using the eye does not affect the healing. So reading, using the computer, watching TV as you feel comfortable. There are also medications that are important. Usually this is in the form of eye drops to reduce inflammation and swelling and to help prevent infection. The exact eye drops or other medications will depend on your situation and your surgeon's usual practice, but you want to follow those instructions carefully. Some surgeons will prefer to inject some medication directly into the eye to reduce the need for eye drops because some of that medication stays in there for a while. Although the downside to that is that you have a little bit less control over the dosing and how long the medication lasts. And then it is very important to follow up on the exams to make sure that the eye is reacting normally to the surgery and to catch any problems as soon as possible. And many problems related to cataract surgery can be managed or treated successfully, but early detection makes everything go much more smoothly. And after everything is done and the eye's measurements have stabilized, then we'll measure you for a new prescription for glasses. So as I mentioned, cataract surgery does have some risks. So there are some risks of complications. Fortunately, most of the things that are common are either time limited or not dangerous. So things like bruising, pain, inflammation, swelling, high eye pressure. Many times the eye drops will help to reduce these things over time. Floaters are also very common after cataract surgery, and floaters are in a different part of the eye that this is the vitreous gel in the back of the eye. And seeing floaters or seeing new floaters after surgery is very common, but most of the time they turn out to be harmless and fade over time. Some dryness and sensitivity of the eye is also very common, just because the surgery makes the eye more sensitive. And again, most of these things, which can be common, do improve with time and with the help of the eye drops. There are some things that are less common that may affect the vision. So a complication called posterior capsular rupture, where the membrane behind the lens breaks during the surgery. And this sometimes can allow some pieces of the cataract to fall into the vitreous, where you need a different kind of surgery to retrieve them. Macular edema, which is a swelling of the retina, sometimes in response to the inflammation of the surgery. Sometimes the swelling of the cornea on the surface lasts longer than usual. Sometimes, very rarely, the lens itself can come out of place or end up in the wrong position and have to be adjusted. So for these kinds of things, the risk is generally in the low single-digit percentages, 1 to 2%, and generally can be treated successfully if detected early. But it is important to follow up with your surgeon after the surgery to look for any of these things that might be starting to happen so that they can be treated as quickly as possible. And the rate of serious complications, fortunately, is very rare with cataract surgery. So there are some possible things that can happen, such as retinal detachment, severe bleeding that causes damage to the eye, or infection in the eye, which can cause damage inside the eye. So these are in the range of 1 in 1,000 or even less for severe things that can cause you to lose vision instead of improving the vision. Long-term, as I mentioned, cataracts don't grow back. So cataract surgery doesn't have to be done again once you have it done once. Some people do develop something called posterior capsular opacification, which is basically a cloudiness of the membrane behind the lens. And this is fairly common after cataract surgery. And sometimes it's kind of misleadingly called a secondary cataract, or after cataract is perhaps a better term for it. But if you develop this after cataract surgery, there's a fairly straightforward in-office laser procedure that we do to permanently eliminate this. And it doesn't, once you have this, if you need this laser, once you have it done, it does not have to be repeated again. And the lens implant itself is permanent. It's intended to last you the rest of your life. It's very uncommon to need to have the lens replaced or otherwise changed or repositioned. It is important to know that although the lens doesn't change because it is permanent and it's artificial, the eye does not stop changing. And so over time, as we continue to age, the eye itself may continue to change, and the focusing power of the eye may change over time, so that over time, the way that the eye focuses drifts away from where it was set during the cataract surgery. So even if you didn't need glasses right afterwards, or just needed over-the-counter reading glasses right after the surgery, it doesn't mean that you'll never need to wear, distance glasses or what have you. Obviously, over time, your body will not stop changing. And of course, other eye conditions other than the cataract will still need to be monitored. So it's very important to continue with regular exams with your ophthalmologist, even after successful cataract surgery. So I'd like to shift gears a little bit from cataracts and cataract surgery and talk a little bit about eye health in general. I'd like to start with some misconceptions that are prevalent out there. So there's a lot of things that we hear about that are common misconceptions. Sometimes it's just what you hear. Some of these things are sometimes pushed by people who have something to sell you. Sometimes it's just misunderstanding. But I'd like to run through some of the more common ones that I hear, and that can help us talk about what are some of the things that we do know about eye health and maintaining eye health. So one common misconception is that only people who wear glasses need eye exams. And of course, glasses are only one condition that requires an eye exam. There's a lot of other things such as cataracts, but also glaucoma or macular degeneration or retina problems and so on. There's a lot of things that can be detected that you may not even know about until it gets to a later stage where it causes problems. So of course, we want to try to catch problems in their earlier stages where they can be treated or prevented, and regular eye exams are important for that. If you don't wear glasses and your eyes are healthy, perhaps you don't need an eye exam as frequently as someone who has a problem, but it is still important, just like having your routine annual checkup with your primary care doctor to look for problems throughout your body, such as high blood pressure or diabetes that you may not even know about. So it's the same thing for the eyes. Another misconception that is common is that wearing glasses will make you dependent on them. And most people do observe that as we get older, we do become more dependent on glasses, but it's not because of the glasses that makes you more dependent on them. It's really just the aging of the eye and the changes that naturally happen in the eye that affect how the eyes focus that makes you more dependent. So wearing the glasses does not physically change the shape of the eye, and it doesn't physically change how the eyes focus. They really just help the eyes focus so that you can see more clearly and more comfortably, but wearing the glasses will not make you more dependent on them over time. So it's important to wear the glasses when you need them so that you can see and function as well as you need to. We often hear about some hot new food, or we often hear about carrots, which sort of that misconception has been around for a long time, that eating more carrots will improve your vision, or whatever the supplement or new food of the day is. And The fact is that there is no single food or single nutrient that is sort of magically, going to improve your vision, or that is the most important nutrient or food. What is important is to get a healthy diet, healthy heart healthy diet that is good for your heart and the rest of the body, which is also good for your eyes. And that may include carrots, but should include a varied, balanced diet of healthy foods, especially fruits and vegetables. People also related to this also often ask about certain supplements or vitamins or nutritional supplements. And there are really no specific supplements that will sort of magically improve your vision. Although for people who have moderate to advanced macular degeneration, there is a combination of antioxidants that has been proven to slow down the progression of those stages of macular degeneration. So that is a situation where we do often prescribe this particular treatment or combination of supplements as a treatment. But otherwise, there really isn't anything particular. It's more important to eat so that you keep your heart and your body healthy. Another misconception is that there are eye exercises out there that can improve the vision or reduce your need for glasses. And unfortunately, eye exercises do not reduce your need for glasses or reduce nearsightedness or reduce your need for reading glasses. Unfortunately, there's just been no exercises that are really found to be effective in doing those kinds of things. Now, there is one condition called convergence insufficiency where there are eye exercises that can actually strengthen that convergence. But other than that, there really are no eye exercises to benefit the actual vision. Some people are resigned to thinking that losing vision is inevitable as we get older. Although there are a lot of conditions that can affect the eyes and the vision as we get older, it's not inevitable that we will lose vision because there are some things that can be treated. There are some things that can be prevented. And it is very possible to maintain excellent vision for your entire life. And so it's important to have regular eye exams to check for those things so that you don't lose vision unnecessarily. I will talk a little bit more about computers and smartphones as well a little bit later, but there is a lot of hype recently about using the computer and the possibly getting damage to the eyes from the computer or smartphone screens or from the blue light coming from these screens. The good news is that using the computer and the blue light that comes from the computer or your smartphone does not physically damage the eyes. Now, you can have some effects such as eye strain and dryness, effects on sleep patterns and things like that, but the light from the screens fortunately do not physically damage the eyes. So there are some things that are important to think about, but certainly it's not something that is actively physically harming the structure of the eye. So what do we know about keeping the eyes healthy? As I mentioned several times, early detection through regular eye exams is very important. And the sooner you can detect something, the sooner you can treat or prevent or reduce the risks of things getting worse. As I mentioned with the cataract, smoking and UV light from the sun are risk factors for cataract, but they are also risk factors for things like macular degeneration, as well as growths and even cancer on the surface of the eyes. So quitting smoking is good for your body. It's good for your eyes as well. Protecting your eyes from the sun is also good for the overall health of the eyes. as I alluded to earlier as well, injury can obviously cause many problems, including cataracts. And so wearing safety glasses or other eye protection when working with power tools or playing sports, protecting your eyes from injury is very important. Keeping the blood sugar and blood pressure under control is also very important. Keeping your body healthy is important for keeping your eyes healthy. And that includes that heart healthy diet, getting good sleep as well, so that it keeps your body in good condition. It's also important to consider your family's eye health history. There are some conditions such as glaucoma or macular degeneration that can run in families. And so knowing what runs in your family, it doesn't mean that you'll necessarily get these conditions, but that way you know that you want to be screened for them. And that way you can help to reduce your risk if you know that you have a higher risk because of your family history. And for those of us who wear contact lenses, it is very important to maintain good contact lens hygiene, making sure that we take care of the contact lenses, which really can increase the risk of infections and other problems, because there are basically little pieces of plastic that sit on the surface of the eyes for many hours a day. So keeping good hygiene, following directions in terms of cleaning and maintaining and replacing them is also very important. So then I did want to come back to the computer and smartphone habits. As I mentioned, the screen time itself and the blue light itself does not damage the vision, fortunately, but you can get eye strain and neck strain from sitting too long in one position, staring at things for too long. And the staring also causes the eyes to dry out more too. So you want to think about these things, and it is important to take breaks when you're working on the computer or smartphone. I did allude to the sleep cycle. So the blue light, being exposed to blue light in the evening, sometimes confuses receptors in the brain into making the brain think that it's still daylight out, and that can alter the sleep cycle and make it difficult to fall asleep in the evening if you've been looking at a lot, if you've been receiving a lot of blue light during that evening time. And so if you have trouble sleeping, one of the things that is often recommended is to reduce your screen time in the evening. You want to make sure that you have the right glasses for working on the computer or the smartphone, because having the wrong glasses or needing glasses but not wearing them causes you to work harder to focus, and that causes strain, makes you tired, and makes you uncomfortable. You do want to remember to blink. That helps with the moisturizing the eyes, and you can use artificial tears, which are available over the counter if needed for that dryness. We're all staring at the screens just like right now for long periods of time every day, and that causes a lot of dryness, and we can replenish moisture on the surface of the eyes by blinking more and using artificial tears. So we have something that we call the 20-20-20 rule. It's really more of a suggestion than a rule, but we want to consider that every 20 minutes, we want to take 20 seconds to look at something 20 feet away, looking away from the screen. And that also allows your eyes to blink, because then you're breaking the staring that you've been doing for some period of time. So it makes you look away and blink the eyes and move the eyes around. It is also important and helpful to adjust the screen brightness and contrast. If you have a high contrast, sometimes that can become uncomfortable. For example, a bright screen in a dark room can be uncomfortable because of that. And you also want to make sure that the positioning is comfortable. It's actually better to have the screen either at eye level or slightly downwards. Looking downwards is better than looking upwards at the screen, because the more you look upwards, the more the eyes actually open, and it is more uncomfortable and unnatural for your neck as well. So the more the eyes are open looking upwards, the more they tend to dry out as well. So adjusting the screen and your desk and your working situation is also helpful. And so I just want to talk a little bit about keeping the eyes moisturized. Dryness is a extremely common problem overall, and especially because we do a lot of activities involving staring nowadays. So computer, smartphone, reading, TV, driving, all of these things where we're staring for long periods of time dry out the eyes. So remember to blink, avoid air blowing around the face, such as fans or hair dryers, the heating or air conditioning, the vent in the car, wind when you're outside. So wearing sunglasses when you're outside, trying not to have the ventilation blowing around your face wherever you're working is very helpful as well. As I mentioned, the artificial tears, these are lubricant eye drops that are available over the counter. So there are a lot of choices out there. We do generally recommend avoiding using redness relieving eye drops on a regular basis. They're fine to use once in a while, but not to use all the time, because over time, it can actually cause the redness to get worse. And the ingredient that shrinks the blood vessels to give you that redness, sort of redness relieving effect can cause irritation as well. So preservative-free artificial tears are the best option for moisturizing the eyes. Especially in the winter or in dry climates, it's good to consider a humidifier, which can make a big difference for a lot of people. And of course, if your symptoms are not improving with these over-the-counter treatments, then of course, a evaluation by your eye doctor is a good idea to see what else might be going on. Or if it's still just the dryness, but it's not responding, there are other things that we can consider doing, prescription treatments, for example, that may be helpful. So I'd like to stop here and open this up to questions. And I think we have some time to see what's on the chat.
Thank you so much, Dr. Wang. We are now at the end of the session, so if you have any questions for Dr. Wang, feel free to enter them in the chat. So we have a question on how does the ophthalmologist determine when you're ready for cataract surgery?
That's an excellent question. As I mentioned, it is a conversation between you and your ophthalmologist, and it depends on the overall eye exam, what the cataract looks like, what the measurements are, but also very importantly, it depends on how much the change in vision is affecting your daily activities. And so that's something that your ophthalmologist will talk to you about, and you will need to think about what kinds of visual problems you're having. And the ophthalmologist will determine whether maybe some of that can be improved with new glasses, or whether there's some other problem inside the eyes that may be affecting the vision, or whether it's the cataract that is primarily causing the problems, and whether they think that the problem can be improved by removing the cataracts. So basically, the final decision is whether at the point when the benefits of doing the cataract surgery outweigh the risks of doing the surgery. And that's something that depends a lot on how much your daily activities are being affected.
Thank you. Are there any drawbacks to cataract surgery? For example, the risk of more floaters?
That's an excellent question. So all surgery carries some risks. So if you don't need surgery and your vision is not being affected, then sometimes the best thing is not to do surgery, because you don't want to take the risks of undergo the risks of surgery and not have some benefit, functional benefit out of it. There are some risks of complications, as I mentioned. You also have to consider that especially in younger people, the artificial lens doesn't work exactly in the same way as their natural lens does, especially in people who are younger, more towards sort of 45, 50, maybe 55 age range, where the natural lens still has some ability to adjust focus, whereas the artificial lens doesn't have that same kind of ability. So there are some drawbacks in that sense, because we are replacing a natural thing with an artificial thing. The question about floaters is is a very good question. Floaters are caused by clumps of the vitreous gel, which occupies the space inside the eye behind where the cataract is. And so when we do cataract surgery, we're not touching the vitreous, and we cannot remove the floaters at the same time. So people who have existing floaters will still have them, unfortunately, sometimes because we remove the cataract and you see more clearly, you do see the floaters more clearly as well. So sometimes it's existing floaters that are more noticeable afterwards as a side effect of seeing better. But sometimes because we're working on things inside the eye, even though we're not touching the vitreous, the changes in pressure can cause the vitreous to move around, and sometimes that causes floaters that weren't really visible to become visible, or sometimes it causes new floaters to form in the vitreous. So sometimes people do develop new floaters after cataract surgery. The good thing about the floaters in these situations is that most of the time they are not harmful, and most of the time, as you get used to them, just like with spontaneous floaters, as you get used to them, they become less and less prominent over time.
So in follow-up to information on floaters, are there any ways to eliminate or minimize them?
That's a good question. It's a very, very common question. Floaters are an extremely common condition, whether it's related to cataract surgery or just spontaneous. And they happen to most of us as we get older. Some floaters are more prominent, some floaters are barely noticeable, but floaters are extremely, extremely common. So there are some ways of eliminating floaters, although so there is a surgery that can be done by a vitreoretinal surgeon to remove the vitreous, and along with that, all the floaters. But there are risks of doing that kind of surgery, especially to the retina itself. And if you haven't had cataract surgery already, that kind of surgery is one of the risk factors that accelerates the growth of cataract. So you may end up needing 2 surgeries, even though you went in for one problem. So most of the time, it's not recommended. There's also a kind of laser procedure that can be done to try to vaporize or disperse the floaters, but there are some risks related to the retina as well. So that's something that usually is not recommended either. But there are some people where the floaters are very prominent. You can't get used to them. They're disturbing disturbing you all the time, and really truly interfering with your daily activity, interfering with working or driving and so on. So there are some situations where considering the risks and benefits of doing surgery, some people do occasionally go ahead with surgery to remove floaters. So it is possible, but most floaters, again, are not dangerous. They're usually harmless for the most part. And so doing surgery is usually not worth it, especially because the brain usually does a good job of getting used to them, and they usually do fade with time. Now, it is important, just as a side note, to say that if you experience new floaters, especially the sudden appearance of many floaters, but any new floaters or flashing lights or some kind of loss of peripheral vision, like some kind of curtain or shadow is covering your vision, those could be signs of a retinal tear or detachment. So it's very important, if you have those kinds of symptoms, to come in to have it checked out right away. So new floaters, flashing lights, or some kind of curtain or shadow covering part of your vision.
Thank you. So you talked a little bit about eating a heart-healthy diet for eye health. Are there any particular foods you can eat to prevent glaucoma, macular degeneration, and cataracts?
That's an excellent question. So for glaucoma, it really does not seem to be really affected by diet. I mean, all of these things are to some extent affected by the overall health of the body. So again, that heart-healthy diet, or basically the balanced diet that's good for your body, is good for your eyes in general. But there isn't anything in particular for glaucoma. For macular degeneration, there is some evidence that oxidation plays some role in the progression of macular degeneration. So antioxidants are probably not a bad idea, but again, it's not some specific product that you need to buy, but eating fruits and vegetables, especially for the macula, dark green leafy vegetables, seem to have some possible benefit. And for people who have moderate to advanced macular degeneration, there is a combination of antioxidants that has been proven to slow down the progression of moderate to advanced macular degeneration. So this was discovered or proven during the AREDS study, age-related eye disease studies. And there were two iterations of that study, so 1 and 2. So they're usually called the AREDS2 multivitamins. And it's not a proprietary combination. It's not a proprietary formula. It's available over the counter from many different brands or generic versions as well. And that contains vitamin C and E, zinc and copper, and lutein and zeaxanthin. So that is for people with moderate to advanced macular degeneration. It was not proven to be helpful in people with mild or no macular degeneration. And then for cataracts, there isn't anything in particular. Again, it's probably related to some degree to oxidation. So having a diet that has antioxidants is probably helpful as well. Again, it's not a particular product or a supplement that you need to take, but you want to think about your overall diet. And smoking also plays into this because smoking is a major oxidative stress on the body. So quitting smoking, if you smoke, is probably just as important as any food that you can eat.
Thank you. So I think we have time for one more question. My dad had glaucoma and macular degeneration, but our lifestyles are very different. Is there any research into the genetic basis of these diseases? For example, should I be worried?
That's an excellent question. So both of these conditions can be inherited. There is a genetic basis for both of these conditions, glaucoma and macular degeneration. We don't know all the genes, let alone how they interact with each other and the environment and lifestyle factors. So we don't know all the interactions, but we do know some of the genes, and we do know that from observing people in families who have macular degeneration and glaucoma, that it definitely does have a hereditary component. But as you allude to, this is the environmental factors and lifestyle factors do play an important part in whether you actually develop these conditions. Just because you have perhaps one gene inherited from your parents, in these kinds of situations, you don't necessarily develop glaucoma or macular degeneration, and not necessarily to the same degree as the people that that also have these genes, because there's a lot of interactions with environmental and lifestyle factors. The level of knowledge that we have is not enough that we can say, these are your genes and this is your risk in terms of a number, and these are the exact things that you have to do. But knowing that you do have some genetic risk factors helps you make decisions as to being screened at an earlier age to detect these problems, and especially with glaucoma, which can be treated, to get treated once, early on before you have problems, as well as, you should be thinking about minimizing your lifestyle factors, risk factors, because you may have a slightly increased risk of these conditions compared to the average person. So it is important. The most important part of this is to be screened early and often and regularly for these conditions, and to minimize your lifestyle risk factors as much as possible.
Thank you so much. So I think that's all that we have time for today. Before we end today's session, do you have any final thoughts you'd like to share with the audience, Dr. Wang?
Vision is one of our most important senses, and you want to keep your vision working for you as long as possible. Keep your eyes healthy. So the most important thing is to have a regular eye exam, looking for problems, and then think about keeping your body healthy, which helps keep your eyes healthy as well. So I hope everyone stays healthy. And thank you for your attention and your time.
Thank you so much, Dr. Wang, for a wonderful presentation. And everyone, thank you so much for taking the time of your day to join us today. Hopefully you found it helpful. As I had mentioned, today's session is being recorded. It'll be posted on the Blum Center website at massgeneral.org/Blum-Center. Thank you, everyone. Have a lovely rest of the day.
Thank you.